Breaking bad news, it's a really common MMI station and no one likes it, but it's actually an important skill for being a doctor, as this is something which we will have to do at some point in our careers. So to help make this easier for you, in this video we got a mock MMI station for breaking bad news, and I'm joined by my friend Aniket, who's playing Mr. Wood in this scenario. After the roleplay, we go through some feedback and talk over some mark scheme related points for breaking bad news. So I hope this video will be helpful for you, but anyway, let's get into the roleplay. Hello there, my name is Rohan Yesudian. I'm one of the doctors in the clinic. Can I just confirm that I'm speaking to Mr. Wood?
That's right.
Nice to meet you, Mr. Wood. Do you know why you've come into clinic today?
I suppose it's about my liver.
Yeah, so you recently had some tissue sample taken from the liver, so the meeting is to discuss the results.
Okay.
Did you come with anyone else to the clinic today?
No, it's just myself. Just myself today.
Okay. So is now a good time to have a chat about the results?
Yeah, I'm free.
Okay. So I'm afraid I don't have good news.
Okay.
Would you like to hear all the information or just the main
Yeah,
points?
all of that. All of that.
Okay, so I'm afraid to say that the results from the tissue sample, we call it a biopsy,
Okay.
it indicates that you have liver cancer.
Cancer?
Yeah. I know that's probably a lot for you to take in at this moment.
I have cancer.
Yes, that's correct.
So does that mean I'm gonna die?
So the thing with your specific cancer is we need to find out more information about it, because if the cancer is only in your liver, we can offer certain treatments to cure the cancer. But
So
if
it can be cured.
it can be, but we don't know if that applies to this specific cancer, because if it's spread out of the liver, it might mean that it might make it hard for us to treat it.
Has it spread out of the liver?
So that's the thing. We need to do further scans now to confirm the nature of the cancer, so we can decide what the best treatment will be for you.
So what's gonna happen to me? Am I gonna be okay? What should I tell my daughter, my wife?
Yes, I understand, Mr. Wood, that this is really tough news, and it's going to impact family as well, not just yourself.
Are you sure? I mean, I feel alright right now. So, are you sure there's no mistake or anything like that?
So some cancers, as you write, you don't feel any symptoms first. I mean, you've only come into the clinic with jaundice. It doesn't mean that there's not a cancer, and the biopsy, so that's the test we did, does confirm that you have liver cancer. I'm really sorry, Mr. Wood.
So, so what should I do now? I don't know what to do.
Yeah, so I know this has been a lot to take in, and I don't expect you to have retained everything that we've discussed. When you leave today, you can meet with one of our nurses, actually just outside over there, and she'll go through more about what your diagnosis is and kind of the support which is available for you and your family. And the next step will be to book you in for this other scan, but don't worry about that for now. We'll be in contact with you in due course.
Okay.
Do you have any other questions for me, Mr. Wood?
Not at the moment, no. I just it's not really sinking in right now.
I understand it's really hard. But yeah, I really hope that we're able to get to the bottom of this problem, and I want you to be assured that we're all working as hard as we can to help you.
Yeah, I appreciate everything you guys do.
Thank you.
Thank you.
So do you have any other questions for me, Mr. Wood?
None.
Okay. So I guess I'll see you shortly. Okay. So let's cut it there. Thank you, Mr. Wood. Do you have any feedback for me?
No, I think that was good. I think you explained the situation simply so that the patient could understand, especially given their state, because they're not going to retain much. You acknowledge that. And yeah, I think that was all right. I think what you did well was you avoided sort of jargon and details about the case and focused on the important bits. So, yeah.
Yeah, thanks for that feedback. And then just to take you through what would be on a typical mark scheme in this. So you might have heard of the spikes framework for breaking bad news. So you might get 1 or 2 points for each one of these stages. So what's it? Let's get S stands for setting the scene. So maybe I could have done this a bit better. So I did introduce myself, confirmed the patient name. I kind of went straight into it. I didn't do much small talk, but I did ask if they're comfortable and if they came with any other people to the clinic. P stands for perception. So this is getting into our ideas, concerns, expectations. So we're asking Mr. Wood about what he expects from the clinic today. One thing which I probably should have done, I probably should have asked what concerned him most about the diagnosis, because maybe there were some things which maybe from a medical standpoint it's not that concerning, but maybe it's really important for Mr. Wood. So that's something for me to improve on. I stands for invitation. So I don't know why it's called invitation. This is basically signposting. So it's like saying, I'm afraid I have some bad news, and then also asking how much information Mr. Wood wants. K stands for knowledge. So this is just explaining a diagnosis and what it means. E is for empathy. So this is like acknowledging that it must be really tough to hear. Things like understanding that the patient is maybe in a state of shock, just so he's unable to like process the information. And it's important to apologize, even though it's not your fault that they have this disease. But even if it's not your fault, apologizing might show some good empathy. And S stands for like solution and summary. So this is when Mr. Wood was asking what happens now. It was me trying to explain that we need to do further scans, and also as indicating that the nurse can be able to give further support with both for Mr. Wood and his family. Some sort of red flags in this scenario would be like not showing empathy or not listening to the patient's concerns and things, and not actually delivering the diagnosis or working through the plan in the allocated time. So one tip for your interviews is to kind of have a watch or be looking at the clock to make sure that you get to the end of the station in their time. But thank you, Mr. Wood. That brings us to the end of the video. Thank you so much for watching. If you liked it, please give it a thumbs up and consider subscribing to the channel for more content like this in the future. You might also like some of my other videos which I've done on the MMI, which will come up on the screen. And remember that I'll also be offering mock MMI interviews and other types of medicine interviews this year. So do check the link out in the description below and also in the pinned comment. But anyway, take care, all the best for your interviews this year, and bye for now.